Hi, this is Dr. Susan Sarajari from Dominion Fertility. I wanted to briefly talk to you about IVF cycle monitoring. So when we go through a natural cycle IVF or stimulated IVF, our patients come in periodically to do what's called monitoring. But what is monitoring really? It is basically whenever you come in, you get an ultrasound and you get blood tests. The blood tests are usually a blood draw for LH, progesterone, and estradiol. And then the ultrasound is usually a transvaginal ultrasound. And this is kind of how the ultrasound machine looks. And we have our probe here, which has a nice sterile cover. And we usually put some gel on there. And then the ultrasound is done transvaginally. The reason we do it vaginally is rather than abdominally because we can see so very much better the follicles that contain the eggs than when we do it abdominally. Now, patients are always worried when they come in, how many eggs do I have? Do I have enough eggs and whatnot? And the egg number varies wildly between patients. So we're not usually very worried about the quantity, but it's more important to have good quality eggs. So when we do those ultrasounds, we measure the follicles which contain the eggs. And usually in a stimulated cycle, the patient takes the medication for about 3 to 4 days and then they come in for the first ultrasound. A lot of times in that first ultrasound, most of the time the follicles are still less than 10 millimeters in size. And then they come in possibly every other day. And that's when the follicles start growing. For a stimulated cycle, we do want the follicles to be at least 18 millimeters or larger before we administer the trigger shot and then go on to collecting the eggs. As you get towards the end and towards egg retrieval, sometimes the patients have to come in every day because the size needs to be just so for us to trigger. And sometimes even in one day, the follicles can grow significantly and you don't want to miss that sweet spot where you can trigger and get the best egg quality. For a natural cycle where the patient makes their own egg and we do not give you medications, we a lot of times trigger a little bit earlier because we don't want the egg to ovulate. And usually around 15.5 or 16 millimeters follicular size or bigger, that's when you do the trigger. And so sometimes for the natural cycles, because we trigger earlier, we bring the patient in a little bit more often, just not to miss that time when they're ready to trigger. That is usually how a monitoring visit works. You come in, you get your blood drawn, you get your ultrasound, and then you leave. I hope this was helpful. Thanks so much for joining me here today. It's Dr. Susan Sarajari.
Dominion Fertility, making miracles happen, one family at a time.